Over my many years helping men navigate the changes that come with age, I've heard countless stories, each one unique, yet often echoing similar concerns. One such story that always sticks with me is about a gentleman I'll call Frank. Frank, a man in his mid-70s, came to see me a while back. He was usually a picture of composure, but I could see the quiet frustration etched on his face. "Doc," he began, "I feel like I'm living in the bathroom these days. Every half hour I have to go, and then when I do, it's just a dribble. And at night, forget about a full night's sleep. I'm up 3, 4, sometimes 5 times." He just felt constantly interrupted, like his body was no longer listening to him. Frank's story isn't unique. In fact, it's one I've heard countless times in my practice, a quiet common struggle that chips away at a man's comfort and well-being. He was experiencing a very common non-cancerous condition known as benign prostatic hyperplasia, or BPH. It's essentially an enlarged prostate gland. And let me tell you, this isn't something to feel embarrassed about. By the time men reach age 50, more than half of us show some signs of prostate enlargement. And by age 70, over 40% will have an enlargement that a doctor can actually feel during a physical examination. As I often tell my patients, aging isn't the end of vitality. It's simply a new season that requires understanding, not shame. It's wisdom, not weakness, to understand your body's changes. So, what exactly is happening with BPH? Well, let's picture your prostate gland. It's a small, walnut-shaped organ nestled right beneath your bladder, and it actually surrounds the urethra. That's the tube that carries urine out of your body. The prostate's main job is to produce a fluid that becomes part of semen. As BPH causes this gland to grow larger, it can start to compress the urethra, making it difficult for urine to flow freely and be released. This compression is like a kink in a garden hose. This obstruction causes the bladder muscles to enlarge and the bladder nerves to become irritable, leading to frequent urges to urinate. Eventually, if the blockage becomes severe enough, the bladder muscles might not be able to push urine past the obstruction effectively, leading to urine backing up. This can result in bladder problems, frequent urinary tract infections, and even the inability to urinate at all, a condition called urinary retention, which requires immediate treatment. Importantly, BPH usually doesn't affect sexual function. While we don't know the exact cause of BPH, researchers do know that it requires the presence of testosterone. It doesn't occur in men who have had their testicles surgically removed or those unable to metabolize testosterone. Recent studies also suggest that a high-fat and high-cholesterol diet might be a risk factor for BPH, and obesity could play a role, with men having a waist size over 43 inches being twice as likely to develop BPH compared to those with a waist size of 35 inches or smaller. Frank's experience with frequent and ineffective urination is a classic example of BPH symptoms. These symptoms are generally categorized as either irritative or obstructive. Irritative symptoms are often the first to appear and are related to bladder muscle issues. They include a frequent need to urinate, numerous trips to the bathroom at night, just like Frank experienced, and a constant urge to urinate. These might be subtle at first, even years after the prostate has begun to enlarge. Obstructive symptoms are linked to problems with urine flow. These can manifest as a decreased force and diameter of the urinary stream, trouble starting the flow of urine, a weak flow, double voiding, urinating, then being able to urinate again shortly after, dribbling after urination, and even overflow urinary incontinence. Other associated symptoms can include frequent urinary infections with a burning sensation during urination and strong-smelling urine, or even some blood in the urine due to stretched and broken blood vessels in the enlarged prostate tissue. The overall impact can be significant, disrupting sleep and causing discomfort, which can seriously impact your overall health and well-being. It's not just physical. This slow breakdown can unravel a man's identity, making him feel distant or less like himself. It's crucial to remember that these symptoms can also be signs of other conditions, including prostate cancer. That's why if you notice any of these changes, you should see a doctor immediately. How we diagnose BPH. When Frank came to me, the first step, as with any patient experiencing these symptoms, was to gather his medical history and conduct a thorough physical examination. I asked him about his urination habits, how long he'd noticed the changes, and if he had any pain or discomfort. Part of this examination included a digital rectal examination, DRE. This involves inserting a gloved, lubricated finger into the rectum to feel the prostate gland. It helps me determine if the prostate is enlarged or has any lumps or areas of abnormal texture. However, it's worth noting that the DRE has limitations for diagnosing obstruction from BPH, as the tissue primarily causing obstruction often surrounds the urethra and isn't directly felt during a rectal exam. A DRE, when done properly and gently, should be painless and quick, taking time to allow the anal muscles to relax. To get a clearer picture, we also conducted a urinalysis to rule out any infection. This involves collecting a midstream urine sample to check for abnormalities like blood or sugar, which can indicate certain diseases. We then performed a urodynamic evaluation to measure the force of his urine flow and how much urine remained in his bladder after he urinated. This helps assess the degree of obstruction. Blood tests were also part of the diagnostic process, which can help rule out kidney dysfunction or screen for prostate cancer. This includes the prostate-specific antigen PSA test, which measures a protein produced by the prostate gland. High levels can suggest prostate cancer, but also less serious issues like BPH or inflammation. Because finasteride, a common BPH medication, can reduce PSA levels by half, I always take this into account when interpreting PSA test results for men on this medication. Sometimes an ultrasound might be used to create an image of the prostate, and in some cases a cystoscopy, where a thin, lighted viewing tube is inserted into the urethra to visually examine the urinary tract, may be performed. No single test can definitively diagnose BPH, but together these tests help us form a clear diagnosis. Dr. Chur treatment approaches. For Frank and many men like him, the good news is that while BPH cannot be cured, its symptoms can be effectively relieved through various approaches. Initially, if symptoms are not overly bothersome, we might suggest a watchful waiting approach. This means keeping a close eye on symptoms to see if they lessen, stabilize, or if certain factors like caffeine, alcohol, or stress aggravate them. Frank found that reducing his evening fluid intake and avoiding coffee helped a bit, though it wasn't a complete solution. When symptoms become less tolerable, we consider more active treatments. Medications. Alpha blockers like terazosin or tamsulosin are often prescribed. These work by relaxing the muscular component of the prostate, allowing urine to flow more freely. While effective for about 75% of men, they can initially cause low blood pressure and dizziness, though these side effects often diminish over time. Tamsulosin may be less likely to cause these initial side effects. Another class of drugs works by actually shrinking the prostate. Finasteride, for example, can reduce the prostate size by about 30% over 3 to 6 months, providing symptom relief for up to 60% of men. However, it can sometimes lead to a decreased sex drive and erectile problems. As I mentioned, it also reduces prostate-specific antigen, PSA levels, so doctors must account for this when interpreting PSA test results. A key point is that if you stop taking these medications, the symptoms will return, so they must be taken indefinitely. Surgical procedures. If medications aren't enough, various surgical options can remove or reduce prostate tissue. Transurethral resection of the prostate, TURP, is a common closed procedure. A special viewing tube called a resectoscope is inserted into the urethra, and a tiny wire loop or cutting edge removes excess prostate tissue. This procedure leads to improvement in urinary symptoms for about 90% of men, but carries a small risk, about 1% of urinary incontinence. Sometimes, if the tissue grows back, the procedure might need to be repeated. Transurethral incision of the prostate, TUIP, is another closed procedure where tiny cuts are made in the prostate to relieve pressure on the urethra. TUIP may reduce the chances of certain post-surgery issues like retrograde ejaculation, semen traveling backward into the bladder. In some cases, especially for very large glands, an open prostatectomy, removal of tissue through an abdominal incision, may still be performed, though closed procedures are generally preferred. Newer treatments. Other treatments such as microwave thermotherapy, intraurethral stents, laser therapy, and transurethral needle ablation, TUNA, are also being developed to eliminate excess prostate tissue or enlarge the urethra, but their long-term effectiveness is still being determined. It's always important to discuss the risks and benefits of any treatment to make an informed decision. Lifestyle changes and self-care. Beyond medical interventions, certain lifestyle adjustments can help manage BPH symptoms. Sticking to a low-fat, low-cholesterol diet and eating more vegetables are associated with a lower risk of BPH. Limiting fluid intake, particularly before bedtime, can reduce nighttime urination. Avoiding caffeine and alcohol may also help, as they can irritate the prostate and increase the need for urination. Additionally, certain medications like oral bronchodilators, diuretics, tranquilizers, antidepressants, antihistamines, and decongestants can aggravate urinary problems, so checking with your pharmacist about your current prescriptions is a good idea. Prostate massage. This is a non-herbal remedy that can be a simple, direct, and potentially powerful way to address prostate enlargement. It is believed to improve blood circulation within the prostate and help remove stagnant fluids by releasing them. It can be done both externally and internally, with or without sexual intent, and is easy to learn. Prostate massage can help alleviate erectile difficulties by strengthening the pelvic floor muscles and stimulating prostate erection nerves, and may also help minimize premature ejaculation by strengthening the prostate muscles. Regular ejaculation, whether through intimacy or masturbation, is protective for the prostate by keeping it active and clearing out old fluids. However, it's important to be gentle. Vigorous or rushed self-pleasure or habits like applying too much pressure, delaying ejaculation, or rushing the process can irritate the prostate, strain pelvic floor muscles, and lead to discomfort or inflammation. Always listen to your body and prioritize gentle touch and complete release without straining. Herbal remedies. Some herbs have shown promise in supporting prostate health. Saw palmetto berry is often recommended for BPH, with many studies showing positive benefits for mild to moderate symptoms and a diuretic effect that can increase urine flow. Turmeric has shown remarkable ability to improve prostate health and reduce inflammation, and one human study showed it improved quality of life for men with BPH. Stinging nettle root has also shown significant benefits for BPH in studies. The African herb pygeum reduces symptoms, acts as an anti-inflammatory, and blocks prostate growth factors. Reishi mushroom has a strong 5-alpha reductase inhibitory effect and a long history of use in Chinese herbalism, appearing to be a safe and health-promoting herb. Tribulus terrestris fruits also have a long history for improving urinary health and reducing BPH. Lastly, corn silk is a traditional herb for urinary health, with studies to substantiate its use, so don't toss it when you eat fresh corn. For Frank, after discussing his options, we decided to start with an alpha blocker and couple that with some significant lifestyle adjustments. He committed to a low-fat, low-cholesterol diet, eating more vegetables, and being mindful of his fluid intake and alcohol consumption, especially later in the day. He even reviewed his other medications with his pharmacist to see if any might be aggravating his urinary problems. We also discussed the importance of mindful self-care, including gentle self-pleasure, to support his prostate health, emphasizing that it's about connecting with his body's current needs, not past performance. A few months later, Frank walked into my office, not with a sheepish look, but with a broad smile. "Doc," he said, "I'm sleeping through the night again. It's not perfect, but it's a world of difference. It's like the lights came back on." And that, my friends, is why we talk about these things. Knowledge, coupled with a willingness to address issues head-on, can truly enhance your well-being, no matter your age. Remember, your body isn't failing, it's simply changing, and that change requires understanding, not shame. It's never too late to reclaim your vitality and live fully and authentically.